Women who lose babies during pregnancy have been promised improved care as part of a new package of measures to boost women and girls' health and well-being. The commitments come in response to an independent review of care in England. The Pregnancy Loss Review made 73 recommendations to the government, including the provision of mental health support for women and their partners and much earlier investigations into recurrent loss. Well, joining us now is Zoe Clark-Coates, who co-led the Pregnancy Loss Review. Good to see you on the programme. You, out of so many people, know what it's like to lose babies. So this review, much needed, would you suggest?
Absolutely, I think it's vitally needed. As a charity, we actually support over 50,000 people a week through the tragedy of baby loss. So I hear from so many people on a daily basis who have gone through the heartbreak of this loss. And so I know radical change is needed, and I hope this is going to be the catalyst for that.
And what are people telling you when they go through baby loss and the heartbreak that they suffer?
Yeah, well, often they're not given any recognition that they've lost a life. So that's the first point I'd want to stress, the fact that people want their baby to be talked about and acknowledged. After that, I think that they want the medical profession to offer them the support that they long for, and that means giving them access to care 24/7. At the moment, people usually have to wait for treatment, and people don't want to do that. They want immediate help in their moment of need, and I hope that this review will be a good starting point to make that happen across England.
Many people hearing this who have not gone through miscarriage or baby loss might be staggered to hear things aren't like that already, don't get round-the-clock care, and the care is what? Been inadequate so far?
Yeah, and I think sometimes it's not for a lack of wanting to do better, it's a lack of finance, a lack of resources. Some units aren't open 24/7. In fact, the majority of EPAU units, which are early pregnancy units, are only open for restricted hours each day, and often only Monday to Friday. What we want to see happen is those units be extended their opening time, so we want to see them being 7 days a week, and every area should have access to a 24/7 unit.
73 recommendations, that's a hell of a lot, isn't it? So what's gone wrong so far?
Well, I don't know what's gone wrong so far. What I do know is the fact that the care that's offered to people has been insufficient, and we need to do better. And what I hope these 73 recommendations will do is really be the starting point of listening to people who have gone through loss and saying, what do they need? What do they feel was lacking? Sadly, we can't stop the majority of these losses, but we can stop a lot of the trauma connected to them. And that starts with good care.
And there's a lot of this about opening up conversations, making people heard.
Yeah, some of it for sure is. And also being led by parents, by bereaved parents, on the language they want to use. Often we hear horrible terms used: failed abortion, products of conception. All of these terms, anybody who's gone through baby loss are probably going to have heard. And it's offensive to the majority of people. They want their loss called what it is, the loss of a baby. And that's what I hope these recommendations will do.
Is it fair to say some people don't know perhaps what language to use when somebody loses a baby? People who've not gone through that. I suppose the health professionals should understand a bit more, and they haven't in the past.
Yeah, and I think some medical professionals absolutely get it right. But sadly, the training that's available for the majority of healthcare staff isn't there, and it's certainly not there for every area of medicine, and baby loss is one of those areas that there's not sufficient training offered. And so one of the recommendations is all about that. It's about changing the education that's available so all medical staff feel equipped to be able to handle any emergency situation. I think often people just assume this is a maternity services issue, but actually when you're looking at pre-24-week loss, often these people aren't registered with maternity services. The only contact they're going to have with a medical professional is perhaps a GP, a practice nurse, and often they're directed to A&E by 111 and by the ambulance service. And again, that's something we want to see change. We want to see ambulances taking people directly to early pregnancy units. And here in England, we're world leaders in early pregnancy care. So the fact that there's so much still to do, I think speaks volumes. But actually, I really believe that the government are committed to making these changes.
Well, that's what I was going to ask you as a final thought. You've come up with all these recommendations. Are they going to be adopted in full now?
Yeah, I really hope they are. I think the government response is extremely positive that they issued straight away. And myself and Sam, the co-chair, we're going to be helping government implement all of these recommendations because we want to see lasting change. So nobody who goes through loss comes out saying my care was really poor.
Zoe Clark-Coates, thanks for coming on to the programme. Nice to talk to you.